Hi everyone, my name is Laura Michelle Castro Chavez. My topic is increased phenylephrine plasma levels with administration of acetaminophen. Definition: over-the-counter combination containing acetaminophen and phenylephrine for the treatment of the common cold and influenza are widespread after substitution of phenylephrine for pseudoephedrine. We have a video.
Phenylephrine is a pure alpha adrenergic agonist. This means it will have its effects mainly by causing vasoconstriction of our blood vessels. And because of this vasoconstriction, you will see an increase in systemic vascular resistance, and as a result, increases in systemic blood pressure. But because phenylephrine acts primarily on alpha-1 receptors on blood vessels, without any effects on chronotropy and inotropy, it theoretically can cause a reduction in cardiac output. Whether or not this is true in reality is up to debate, but most studies show that cardiac output is either maintained or actually increased in patients without pre-existing cardiac dysfunction. You may see phenylephrine commonly used as a pre-made syringe in things like anesthesia or post-op intubation-induced hypotension. It is also seen in cases of hyperdynamic sepsis and other neurologic disorders causing hypotension. So in summary, phenylephrine's main effects is to cause vasoconstriction, which leads to increases in vascular resistance, and as a result raises systemic blood pressure.
Okay. Now application. The administration of phenylephrine at a dose of 10 mg in combination with acetaminophen, 1,000 mg, and ibuprofen, 300 mg, as compared with the administration of 10 mg of phenylephrine alone, resulting in early a quadrupling in the maximum plasma concentration and a doubling in the area under the curve. We have another video.
Pseudoephedrine is a nasal or sinus decongestant that is also commonly used as a stimulant or wakefulness-promoting agent. Different salt forms of pseudoephedrine are found in many over-the-counter cold medications, often in combination with an antihistamine, expectorant, and/or pain reliever. It has recently been replaced in many products with phenylephrine, which has similar properties but may not be as effective. Pseudoephedrine acts by binding to two receptors called alpha and beta-2 adrenergic receptors that are found in different types of muscle cells. Muscle cells that line blood vessel walls contain alpha adrenergic receptors. When pseudoephedrine binds to the receptors, the activated receptors cause the muscles to contract, and in turn causing the blood vessels to constrict. These constricted blood vessels allow less fluid to flow from the blood vessels into the nose, throat, and sinus linings. This leads to reduction in inflammation of the nasal membranes and production of mucus. Beta-2 adrenergic receptors, on the other hand, are found on cells in the smooth muscle of the bronchi, which are the main air passages that connect the trachea to the lungs. When pseudoephedrine activates beta-2 adrenergic receptors, it relaxes the muscles, thereby leading to dilation of bronchi. This leads to reduction in congestion and improvement in breathing. Therefore, the impact of pseudoephedrine on the two types of muscle cells resulting in contraction of sinus blood vessels and relaxation of the bronchial passages combine to make it an effective medication for relief of cold and allergy symptoms.
Pros and cons. We have problems with relief symptoms but doesn't speed recovery. Short-lasting direct agonistic effect and increase the P of perfusion in the brain, kidney, and heart in a state of low SVR. Coronary CPP increase without increasing myocardial contractility. And cons, It can decrease the systolic volume due to an increase in afterload, bradicardia due to reflex vagal stimulation, monitor diuresis and perfusion in extremities. Profit in Ecuador. The problem of allergy has risen widely in the world. Ecuador is no exception, and it is common to comment on children who frequently suffer from rhinitis, asthma, or flu. We have a video.
Nasal allergies, also called allergic rhinitis, are very common. As you breathe, allergens such as pollen, mold spores, or animal dander cause your body to release chemicals that create a collection of symptoms, mostly involving the eyes and nose. Many people with allergic rhinitis also have other nasal and sinus symptoms. Drainage from the nose and sinuses can make rhinitis worse, especially at night. In a recent survey, almost 90% of family physicians recommended nasal saline irrigation for sinus and nasal symptoms. A saltwater nasal wash, or saline irrigation, helps to clean mucus from your nose, decrease nasal swelling, and increase airflow. It can also rinse allergens or pollen from your nose and make nasally administered medications more effective. Regular nasal irrigation helps remove bacteria and viruses from the nose, which reduces the potential for infection. It also moistens tiny hair-like structures called cilia. They pass allergens and other invaders like bacteria to the throat, to be swallowed without causing harm.
Okay, finally conclusion. Nasal decongestant like phenylephrine are as effective in clearing our noses as a more placebo. In fact, the same study authored as the US Food and Drugs Administration to immediately remove phenylephrine from its list of active nasal decongestant. That's it. Thank you.